Welcome to episode 110 of the Sleep Whisperer podcast. Dr. Anurag Bajpai underwent postgraduate training from All India Institute of Medical Sciences, New Delhi. He was awarded fellowship in endocrinology by the Royal College of Physicians. He has authored over 50 index papers, 30 textbook chapters, and 2 books related to pediatric endocrinology. Dr. Bajpai is the section editor for endocrinology in Indian Journal of Pediatrics, reviewer for Pediatrics, Indian Pediatrics, Journal of Pediatrics, and Journal of Pediatric Endocrinology and Metabolism. His area of research includes the role of estrogen in peripubertal males, neuroprotective effects of insulin-like growth factor 1, growth hormone deficiency, pubertal disorders, obesity, rickets, congenital adrenal hyperplasia, and type 1 diabetes. He has authored Practical Pediatric Endocrinology and Children with Diabetes. Dr. Bajpai has taken active interest in spreading awareness about pediatric endocrinology and has set up Grow India, a non-governmental initiative to improve care of children with growth disorders. Why is sleep important for the endocrine system? What happens to the hormones when we sleep? What are the effects of lack of sleep on our own hormones? What are the effects of sleep disorders on growth, metabolism, obesity, reproduction, and glucose metabolism? How do different circadian rhythms affect the endocrine system? This is something that we must discuss in the modern context of genetic circadian rhythms that differ and supposedly predispose us towards being a night owl. What do we need to know about this? We also go into a big mistake that is made by many people with hypothyroidism that impacts their entire health. Take a listen to see if you might be doing this as well. Endocrine health is linked to everything from physiology to psychology. It is truly the master system of communication, and there was a reason that even ancient yogis correlated endocrine health with energy systems. It is a beautiful system that responds to subtleties in and around us. We can influence our endocrine systems positively with subtle daily practices. Sleep and endocrine health are truly interconnected magically. This episode is bursting with scientific information and practical tips to help you improve your own endocrine health and support all healing. Take a listen to episode 110.
Hey everyone, I'm Deepa, Light Functional Medicine practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey. Dr. Bajpai, it's a pleasure to have you here today on the Sleep Whisperer podcast. And I've been wanting to do an episode on endocrine function and sleep for a very long time because personally I know so many people with different endocrine challenges, including thyroid or diabetes, and I think there's a lot of misconception in this world of endocrine health, but somehow I thought you would be the perfect person to talk about this, which is why I was very keen to have you here today. And we are speaking about sleep and endocrine function, the nuances between all of this, but and you are of course a great expert in this field, and I don't have to go into that. I would like, though, for a quick look at what brought you into the field of endocrinology. Was there some personal story, or what was the fascination that drew you towards this?
Good morning, Deepaji, and thanks for inviting me for this program. So, endocrinology was in fact a fascination right even from school days. Somehow I was really fascinated by the way hormones interact and the very concept that something produced at a very remote part of the body can affect across the body and will have different effects in different systems was something which was really fascinating. And as I went into the medical school and started evolving interest into different aspects, I really liked the physiology of these hormones. Then, as we went to the clinical aspects, how they interact with other diseases, and how mathematically we can really make a diagnosis in these cases, evaluate and manage. And I think that's what the overall clarity of concepts, the way we can treat, the efficacy really brought me through this endocrinology. So it's been a very interesting scenario for the last couple of decades, at least in terms of endocrinology.
And I think endocrinology is really one magical space, doctor, because it's kind of subtle, but it's also so powerful in the effect it has on every part of us, our energy, mood, appetite. And maybe we can get started by speaking about why is sleep really important for endocrine health?
Yeah, I think sleep is one of the most important and the most productive time that we are utilizing. This seems a bit paradoxical because most of us in this day and era talk about doing more work, getting more time in terms of doing work, less about these recreational activities, and sleep is probably often considered something as lethargic, something which is non-productive. But I would go to the contrary, that sleep is the most important part of a human life. Now, it's very simple and logical to understand that if somebody is spending 30% of their lives in sleeping, and if it was not going to help, evolution would really have taken it off. So, if sleep is not going to help you out, it is the biggest evolutionary mistake as to why the evolution has not taken it off. It really means that it is doing a very, very important and a vital function. Now, if we simply try to see what happens during sleep period and what happens during the daytime waking period, I would say sleep is the time when we are building up our resources. We are trying to really, in a way, making our overall parts in which we are getting things done. And during the day, we are utilizing them. So sleep is more like one phase of life where things are being stored, things are being reset, while in the morning, in the waking time, we are using those resources. And when we talk about hormones, the hormones also are, broadly speaking, two groups we can classify. One, which are more of anabolic, which are basically building the body structures, maybe muscle, maybe bone, maybe growth, and those aspects, and catabolic, which are providing us instant energy to utilize and do activities. And both are extremely important, and therefore the balance is important. So sleep actually plays a very important role in shifting the balance between these catabolic and anabolic hormones, and that gives a very important clue. So if you look into the simple perspective, during the sleep time, we have hormones like growth hormone, which really go up, gonadotropins, which are going to control the reproductive functions, the pubertal development, they tend to go up. So body is trying to grow more, is trying to stimulate the development. So it's like growth, development, and puberty and reproduction. They are all getting activated during sleep. And the hormones which are involved in countering us with stress, like cortisol, these hormones will go down. So we have a very favorable environment for the individual to grow, to have better physical development, to have a better pubertal development without the effect of the stress hormones. So you're in a way building your resources, your muscles, your bone, your fat, everything. And when you go up in the morning, when you want to use them, you want to do more work, right at that time, you will have a peak which starts in terms of the cortisol level, which is the hormone which is the most important as far as stress is concerned. And that will provide you with the energy to counter. So if we think of humans who have evolved over time in a situation where they had to really work hard for getting their food, work very hard to really get all the resources which were very scarce, they had to work a lot from morning. So at that time, you needed the maximum amount of energy, maximum amount of concentration. And then probably what you're looking out is using your resources. So then your growth hormone, your other hormones will tend to go a bit down. You're basically trying to build up, use those resources, and that's why cortisol goes up. So this whole cycle of sleep and wakeness will really give you an idea as to how we have a time where we are building up, and then utilizing. So it's just like any other cycle you can think of, investment cycle for that matter, studies for that matter, the same phenomena which is being reflected in sleep. And that's how it's very, very important from an endocrine perspective.
Beautiful, doctor. I loved your connection to the evolutionary aspect, because really I don't think many people would wonder today about why we do, because there is, as you yourself said, that we are living in an age where there is so much of emphasis on doing. And sleep has definitely taken a back seat for many, including children, where now you see a delayed sleep time in several cases. But first, let's talk about what's happening to our hormones in sleep, and that will also give us a framework to begin talking about a very important aspect later, which is the sleep timing as it plays into endocrine health.
So as I've already mentioned, the sleep is a very, very important time in which we are not only resetting all the problems which have happened, we are also in a way focusing about more towards growing. So sleep basically means that you are in a secure environment, you have enough to eat. So a person will sleep basically when everything is perfect. And when you are in that ideal situation, you would like to grow. If you talk about from an individual perspective, if you have enough money, you've got a secure home, your family is good, you want to grow. The same is about sleep. To have a good sleep means that you had eaten well, you are well physically, there is no physical issue, there is no pain. And then of course the body will say, okay, now it's a good time to grow. So what it does, and if you talk about the major hormone systems, let's go one by one. So we have got from the pituitary, which is the most important regulator of the entire body system, the growth hormone becomes high. So when we see often that children who are actually sleeping well will grow well, the reason for that is that the growth hormone is largely produced during the phase 2 to 3 of sleep, and that is the time you will have peaks of these growth hormones which are coming. Now, a lot of these hormones are not continuous. We need to understand that it's not that body is continuously producing an amount of hormone. There are peaks which are coming in, troughs which are coming in, and they will have a significant diurnal variation from day to night. They will vary, and large amount of this variations are related to sleep in that perspective. So growth hormone, one of the most important hormone as far as the growth, not only of children, but also a lot of other metabolic effects, muscular growth, bone growth, fat loss. All these substances, growth hormone will go up during sleep in terms of peaks, or let's say the peak secretions, number of frequency will become more. So that will allow us to gain more muscle, more bone, less amount as far as fat is concerned. This is what growth hormone will be doing in that perspective. The second major hormone which is coming from the pituitary is the gonadotropin releasing hormone and the gonadotrophins, which are regulating the functions of the gonads, the testes, and the ovaries. Now, if we talk about pubertal development, which starts right around 8 to 10 years in girls and 10 to 12 years in boys, the first change which happens is that during sleep time, these hormones tend to start. So basically, the first time when these hormones kick in is actually at sleep. And that's why body becomes good, and now the development happens. So a lot of these testicular development, a lot of these ovarian development, and secondarily, the development of the physical characteristics is dependent on sleep. If you do not sleep well, your reproductive hormones will also get altered, and that will, of course, have a major impact from that perspective. Now, if we talk about third group, which is very, very important for the body functioning, which is the pituitary adrenal axis, which is really regulating a lot with regards to our stress response, our glucose levels, our blood pressure. It is more of utilizing your resources. So while growth hormone and gonadotrophins are trying to build up resources, this is utilizing resources. This hormone will be very high, as I discussed, at the dawn time, there will be a peak. They will remain high during the day, and they will come down around 12 o'clock. And that is correlating again with sleep. Now, why is that? Because sleep is the time you don't have any stress. So why do you need to have this hormone at that point of time when there is no stress? And lack of this, because this cortisol is not only going to help, not only is going to help you in terms of building your sugars, in terms of increasing your blood pressure, but at sleep time, if your sugar goes up or your BP goes up, that would be detrimental. So while the body is increasing growth hormone and gonadotropin on one hand, it is suppressing cortisol on the other. And this diurnal rhythm of cortisol is very, very important. And when we discuss about how Lack of sleep causes diseases like metabolic complications like diabetes, hypertension, or even polycystic ovarian disease. This is this rhythm of cortisol which becomes very, very important. Now, thyroid is another major hormone which does see a lot of fluctuations in that perspective. Again, the levels are more higher in the morning time, and that's again because you need more energy, and the thyroid is also associated with energy in that perspective, tends to go down during the sleep hours again, because if you have too much thyroid, you become catabolic, you're using your resources. While if you have less thyroid, you will grow. So this is what happens in terms of thyroid. So broadly speaking, we talk about four major classes of hormone. The growth and reproductive hormones are high at night. The stress responding cortisol and the catabolic thyroid are low at that time. So there is a good balance in a way. So what you're seeing here is that sleep is a time where there is the ideal situation, body wants to grow. Daytime is the time you want to use those resources because you are into adverse situations and you're using those hormones to go forward. And this is the ideal balance which happens during sleep and wake tests.
I'm so glad, doctor, that you keep bringing emphasis back to the diurnal rhythm, and we'll come to that when we talk about timing. But what does general lack of sleep do to hormones? You describe the hormones so beautifully and what happens in good sleep, but what's happening if someone is not sleeping, which is a big factor today, and there's so much hypothyroidism and pre-diabetes everywhere that why is sleep so important, and how is it disrupting, how is lack of sleep disrupting our endocrine function?
Yes, that's a very, very important part to understand, because once we know the reason, it becomes much easier to correct the basic cause. Now, if we discuss if we have lack of sleep, and when we say lack of sleep, there are two aspects. There would be issues with regards to not only in terms of the aspects of that we are talking about in terms of the quality of sleep. It's the quantity also. Quantity and quality both are very, very relevant. So we'll talk later on maybe as to what is the ideal amount of sleep in different ages, but that's a different issue. But both quality and quantity of sleep are absolutely important to have a good endocrine functioning in that regard. So if there is lack of both of them, we will find that at times when we do not need the stress hormone, cortisol will go up. So if your cortisol goes up at night, you will have high blood pressure, you will have high glucose, because that's something the body wants when you are in stress. That of course will have a long-term complications in terms of development of diabetes, development of obesity, development of insulin resistance, polycystic ovarian disease, non-alcoholic steatohepatitis. So lack of sleep on one hand is a major predictor of obesity and metabolic complications. We actually did a large school study in which we evaluated over 5,000 school children in our region, and we looked into the various factors about why they are becoming obese, and we found a stunning prevalence of around 20-25% as far as obesity is concerned in affluent school children. When we looked into the various factors, we looked into the lifestyle factors in terms of physical activity, sleep time, in terms of the amount of junk food consumption that they do, and then correlated that with the BMI, which is the body mass index, which is the indicator as far as the obesity is concerned. And very importantly, with body fat. So we actually measured body fat using a specific equipment there. We clearly found that one of the most important factors which determined the obesity and the body fat was sleep hours. Children who were not sleeping, who were sleeping 1 hour more, had a 10% lower body fat compared to those who were sleeping less. So just by increasing sleep, one can really change the body fat percentage. Now, this body fat percentage is something which is going to determine your complications, determine your blood pressure, determine your all those factors. So sleep hour is absolutely important as far as these metabolic factors are concerned in terms of all these factors. Now, this was one about the metabolic issues. Of course, as I discussed, growth hormone requires a deep sleep. It requires stage 2 to stage 3 sleep. So if somebody is sleeping, but it's like a poor quality sleep, you will not be producing growth hormone, and that will really have an effect with regards to the growth of the child. Similarly, you will not have a lot of these gonadotropin secretions coming in, and that will of course have an impact with regards to the reproductive development. So if you have a bad sleep, there is a tendency of developing obesity on one hand with all its complications, which is diabetes, fatty liver, hyperlipidemia, polycystic ovarian disease on one hand, and on the other, you have a tendency of not growing well, growth hormone deficiency. It's not just about growth, your muscle will become less, bone will become weak, and of course, problems with regards to pubertal, reproductive, all those connotations will start happening. So, sleep quality and quantity both are of vital significance in this regards.
And maybe you could share this research you did, Dr. Bajpai, so we link it as well to the show notes, because that was very interesting. And I would also like to take a look at that. And when you say it impacts the reproductive aspects in children, have you noticed any link in that to early puberty or how does it play out when you say that it can impact reproductive aspects? What are the typical things that you've come across?
There are a lot of studies which are going around with regards to the sleep impact on the pubertal development and reproductive aspects. Now, there is no one-to-one correlation, I would say, because early puberty is overall, and there is a lot of tendency that we are seeing that children tend to have an earlier puberty nowadays, and there are multiple factors which are associated. And I would say sleep lack is one of the major factors. Now, if we look in a simple perspective, studies have clearly shown that girls who are obese or overweight have an earlier chance of having breast development and an earlier chance of having periods in certain situations. Now, obesity per se, therefore, is a driving force, and this is probably working through another group of hormones which are known as leptin and ghrelin, which are basically coming. Leptin is a hormone which is produced by the body fat, which tells us, okay, how much is the body stored as far as the fat is concerned. And ghrelin is coming from the stomach saying that you're hungry, eat more. That is the perspective in that regard. So if somebody has got too much leptin, the body will, which basically means that there's too much fat there, the brain will say, okay, now we've got enough resources, we should now enter puberty. Now, why does puberty basically happens? And why does puberty happen in that perspective is that puberty and pregnancy, these two are situations which demand a lot of energy from the body. They are all requiring a huge amount of load on that particular individual. So if the body feels that there is not enough energy required there, it will shut it down. So on one extreme, if you have got too little leptin, it will say, okay, you shut it down. But if you've got too much, it will say, okay, this is at the right time. And maybe even before the time is there, pubertal development may happen. So there is a definite link with regards to obesity and early puberty. And this link, I would say, is clearly linked also from sleep habits, because they have a direct impact on obesity, direct impact on leptin levels as well. On the other hand, if there is too much issues in terms of sleep, like somebody is really disturbed sleep, cortisol will go up. And this cortisol is going to affect the ovaries, it's going to affect the overall reproductive functions. So it will not only cause early puberty, there will be a disjuncted puberty, and features of what we call polycystic ovarian syndrome, in which ovaries have an imbalance in terms of hormone production, will also become manifest. So it's a very, very vital link between sleep and reproduction, because as I said, sleep means you're doing well in life. If you're able to sleep well, you are having a contented life, body can then want to grow. If you don't have enough sleep, body will say, okay, this person doesn't have enough resources, he's already stressed with 100 of things, why are we putting a load of reproduction on that perspective? So it's a very simplistic way to look into and comparing them.
And we did speak a little about the diurnal rhythm, and I would like to talk about that. As I mentioned, that there is a lot of, recently I had a girl come to me who was 12 years old, and her normal sleep time was post midnight. And she said, but auntie, that's how we need to stay up and we need to study. So this seems to be a common trend, and there doesn't seem to be emphasis that there is something concerning about this in terms of impacting physiology. So do you feel that there is that there is an ideal bedtime, or are there, in your view, do you believe that people have different circadian rhythms? There's a very popular book by Dr. Michael Bruce, which describes 4 different chronotypes for sleep. And there is a lot of talk about this today on social media, that some of us are meant to be the night owl, and where our regular bedtime is beyond midnight, and that's probably what helps us to function really well. And people say that there are genetics that point towards our sleep chronotype. In your long experience, do you feel that we are meant to have different sleep chronotypes, and some of us are possibly meant to sleep much later than others? Or do you feel that there is a link between the diurnal rhythm, the light dark cycles, and endocrine? And how is this all impacting endocrine health, especially when it comes to these 2 major endocrine challenges that we see a lot of people struggling with today, which is hypothyroidism and insulin resistance?
That's a very, very important point that you've brought in. And this is very relevant because we've talked about the quality of sleep, we've talked about the quantity of sleep, and now the very important factor is the timing of sleep. Now, a lot of people say that if you are sleeping maybe 7, 8 hours a day, it doesn't matter whether you sleep at 12, you sleep at 9, you sleep in the morning also. But I would like to differ from that perspective. So whatever people talk about increased efficiency, like doing better in that perspective, is more to do with programming, the way we have programmed ourselves in life, that we want that sort of an environment. And then that is more like that rather than any physiological basis. Now, of course, when we talk about a distribution of individuals, we study hundreds of thousands of people, we will find that everybody will have a bell curve distribution. So if you talk about height, somebody will be at the average height, will have the maximum people. There will be some who are short, and as we go towards extreme, the numbers will become very less. Same tall people will be there. So there might be some people who are on the extremes who may be having a different sort of a chronotype, so to speak. But to say that 99% would actually fall into that typical bell curve. And I'm not sure as to how you're going to determine that genetic basis, even if you do a whole genome sequencing to identify which gene determines that particular chronotype, because we don't even know many times that even if you do a genetic test, diagnosing a disease may be difficult because some variations are normal, which are there in that perspective and difficult to correlate. So I would say rather than going into this genetic basis and saying that, okay, this particular phenotype or a chronotype requires a different sleep pattern would not be appropriate. It is there that there's a normal distribution. Some people would prefer maybe sleeping a bit early, a bit late. But if we go on extremes, we're talking about less than 0.1% of the population, and how to determine that becomes difficult. And we clearly see those situations that they are actually doing harm than good in that perspective. We see a lot of people who are doing call center work who tend to have a different nighttime cycle, a lot of shift. Even as medical professionals, we did a lot of duties. It really had a very bad impact in terms of how you feel the next day. And a lot of these metabolic complications that we are having, people becoming sick early, and we now see so many young people having so many cardiac issues. I would say sleep deprivation is one of the major important factors. And it's not just sleep deprivation, it is the timing of sleep, which is also very vital in that perspective. So I would say stick to a schedule, and that's very, very important in that regard.
And there was, I listened to Dr. Michael Bruce somewhere where he said we've actually tested endocrine function in chronotypes which are night owls, and in their body, cortisol and melatonin have a different rhythm, and it's spiking and moving differently to others. What would you say to something like that? Is it because they're already in that sort of a rhythm that their body's shifting? Is that going to at some point probably trigger some abnormal function? What are your perspective on that?
Yeah, so I think that's a very interesting point. There are 2 aspects. One, of course, is how many people are we testing? When we talk about 100, 1,000, even that doesn't make a sense because we're talking about billions of population. You can't just have such a small sample size to really look at it on that perspective. So that has to be looked into. So if you talk about medical research, what often people say is that you can get any result depending upon any sample size you want to, because they are not representative of the entire population, so to speak, in that perspective. Now, second point is very, very valid, that if you have been living throughout your life, that's why I talk about conditioning, that you have been living throughout that time, the body will say, okay, this fellow is always awake in the night time, so I can't have cortisol all the time. And that will cause, so it will try to shut down. So this is more like a acquired effect, not that they have a congenital issue in that regard. So 1 in a million may be like that, but you won't expect that half the population will be like that. So if somebody is doing that, this may be a programmed phenomena which may happen. And when this is a programming, it means that the body has to put extra efforts in curbing those hormones at that time when they should not be high. And that itself is going to take a toll. And there will be a time when this mechanism will fail and they will have a lot of issues which will come up in that perspective. So I would say there are a lot of issues which are there, which have been raised in terms of all these factors. There is not much scientific basis onto that. And even if we consider that some people may have a normal profile which is there, it may be more because of the sleep pattern that they are using. And the sleep pattern is not because of their hormone profile. It's the other way around in that perspective. And I would say it's not desirable from that perspective.
Good, doctor. And I would like us, before we actually go into how do we look at sleep and how do we look at improving sleep, just a little bit into hypothyroidism, because one thing that I've come across in a lot of people who have this altered sleep timing, sometimes they're sleeping past midnight, and then they've been told by their doctor to take their medication, their thyroid medication in the morning, and sometimes they wake up, they take their medication and they go back to sleep, and then they wake up at a much later time. Is there something to also, what I'm asking is our sleep and wake cycle important in the timing of our medication and the effect of the medication? Is it going to impact positively or negatively if someone takes a medication, goes back to sleep and only to wake up several hours later and then eat their meal? Do we need to follow sleep-wake cycle in according to our medication?
I think that's a very, very valid point. In two particular hormone replacement that becomes really relevant are thyroid and adrenal disorders. So thyroid is absolutely important. And why are we taking in the morning? So one thing, of course, is that if you need thyroid to absorb properly, you want a gap of 30 to 45 minutes between the medication and having anything. So that's why morning suits most people. But the second big reason is we are trying to mimic what body does. We want to mimic physiology. So what we're doing is that in the morning, as I said, you need thyroid to become more active. You take that medicine. Now, if you're taking thyroid, and the maximum level will, of course, be around that time when you're taking the medicine, and then they will try to taper off over time. So if you're taking the thyroid medications and sleeping again, this is going to be a very difficult situation. You are taking something to boost your energy, and then you're going to a fact when you are actually trying to curb your energy. So it doesn't make really any sense to wake up and take the medicine. So we will always say that you get up at the right time and take the medicine. But let's say you're not able to wake up at around 5 or 6 o'clock, you're waiting at 8 o'clock, take the medicine at 8 o'clock, because that's when your clock is there. But of course, if you want to do it at around 12 o'clock, that of course is not desirable. But if somebody wants to wake up at 7 or 8, which is not desirable, but okay, acceptable, take the medicine. Then don't set an alarm at 5 that I'll take the medicine at 5 and sleep again, because that's going to cause a huge confusion to the body that, okay, now this fellow has got such a thyroid now, and why is the person wanting to sleep? And that becomes a problem. The second big is the adrenals. And adrenal we talked about, there is a high level in the morning, which goes a bit slow in the evening. So when we talk about treatment of children who have adrenal disorders, adults who have adrenal insufficiency, we talk about higher dose probably in the morning and a lower dose in that perspective. And medicines are being designed which will allow the dual release of these medications. So immediately high and then a slow release which will come up. So this is very, very important from a medical perspective. And the reason why it is important is all about sleep. Because this is that sleep-wake cycle. When you want to be more active, you want more cortisol, more thyroxine. If you take them and you sleep, it's not making any sense in that regard.
I really appreciate you saying that, doctor, because I think in many of these cases, some of these people then start to get concerned that their fatigue is not getting better, they are not doing better, and then they're pushing the doctor at times to increase their dose. And sometimes, yes, of course, we need the medication, but we also need to support it with just the basic, whatever we need to do. And one of the most important aspects is sleep. So I was very glad to hear you clarify that. This is a trend I'm seeing more and more every time. And that's why I wanted to ask you about that. Maybe since we could talk a little bit about what would be the ideal sleep regimen in terms of what do you suggest in terms of meal time, going to bed? What can we do to improve sleep if we are having poor quality of sleep? And if we are someone who has endocrine challenges, maybe on medication, be it hypothyroidism or diabetes, what would be the ideal way that we support ourselves and give probably give the medication a scaffolding and framework so that it can do the best job for us?
I think that's a very, very valid question. And this is relevant for individuals who have different types of hormone disorders, as well as those, everybody, I would say, overall should have a healthy pattern as far as sleep is concerned. So when you talk about sleep, as I said, there are three key aspects: the quality of sleep, the quantity of sleep, and the timing of sleep. All three are important. So let's go one by one. If you talk about quantity, there is no perfect hit which we can say, okay, this is the exact hour, exact minute which everybody should sleep. But roughly speaking, we're talking about 7 to 8 hours seems reasonable from more study perspective. And studies show people below 6 definitely have a huge problems, and more than 9 may be a bit of the mark in terms of having over this thing. So while there will be a variation, there will be a normal curve which is there in terms of what's the ideal amount of sleep which is there. I would say 7 to 8 would be the good fit in that perspective for all the individuals across board in that perspective to start off. The second very important thing is the quality of sleep becomes important. So the quality will depend upon your environment and how the environment is impacting you. So key important things to remember is that when you're sleeping, you want your mind to be absolutely at the calmest. So things which can stimulate the mind. Things like, I would say, having a caffeine drink in a recent past, having television, having mobile, and all these things are becoming very common that we're keeping all these things in our bedrooms. We are seeing TV and we sleep while seeing TV. We are actually having the mobile just beside our side. And that, of course, will have a lot of other impacts as well, but you are seeing it right at the time, and then you sleep and then wake up again, the first thing you see is the mobile. So these things will really make a huge impact as far as the mind is concerned. Less noise, light, all those factors are important. So when we talk about sleep wake cycle, it's also about the light dark cycle, as you nicely pointed out. So light also becomes important. So I would say keep control of your environment. That would include less noise, less light, no exposure to things like which may stimulate like television or mobile or other aspects just before sleep. The third important thing perspective would of course be what should be the relationship with the meal, with physical activity and other regards. So generally speaking, we have clearly shown that if you have a earlier dinner, at least a 2-hour gap between dinner and sleep is what we would recommend, and a bit of mild physical activity, not too much of physical activity, but maybe a stroll, a walk for 20-30 minutes after the dinner will allow all these nutrients to, in a way, be metabolized, to absorb, so that the body doesn't have too much load to really work out, because digestion is a slow process. It's not just that you've taken the food and then it will automatically get digested, and digestion requires a lot of energy, a lot of work from the stomach, from a lot of these pancreas, which will secrete the enzymes and other factors as well. So you need to give some time for your meal. So if you have a light dinner and you wait for 2 hours, maybe do a bit of physical activity at that time, that would be an ideal recommendation. Now, what time should you sleep? Now, this again is a difficult situation to say for everybody, because we do understand there's a lot of other issues that's concerned. But I would say probably better would be to be closer before 10 in most cases. Beyond 11, I would be a bit difficult because that's the peak time when the hormone goes down. So if you look at a normal individual, the cortisol is lowest at 12 o'clock, midnight. So you should be in a reasonable time to sleep by that time. So I think 12 is the time when we want you definitely sleeping. So 11 may be an appropriate time. 10 would be even better in that perspective. And of course, you can have some variation there in that perspective. And then from there, if you talk about 7 to 8 hours, that would be the ideal time. Maybe 5 to 6 will be the right time to wake up in that perspective. So this is very, very important. Now, there are various physical conditions, of course, which can affect sleep. And we talk know about obesity and sleep apnea. So those things, of course, will require a different perspective. And we know that individuals who have sleep apnea, who have poor quality of sleep, have a much higher chances of diabetes, complications, cardiac disease, and other aspects in that regard. So I think if we broadly talk about 2 hours after dinner, maybe no television or mobile for an hour before you do a light physical activity, sleep around 10 o'clock, and maybe get up around 5 to 6 will be a reasonable thing. There may be some here and there variations there, but not gross violations in that perspective. Something we should not do would be to sleep after 12, which may not be appropriate, and getting up too late or getting up and sleeping again. These sort of things, as you said, should be discouraged in that regards.
One of the things, doctor, that a lot of women have spoken about is that they go to sleep and then they wake up in the middle of the night, somewhere around 1 to 2 a.m. and then they feel highly anxious at that time, and everything that is troubling them during the day seems magnified at that time. Do you have any thoughts on what could be contributing? Is it not eating enough, or why do they feel that anxiety peaking at that specific hour of the night if they wake up?
That is not really part of physiology, if you speak, because in physiological terms, our BP is the lowest, the blood pressure is lowest around that time, sugars are a reasonable state. So there's something else which probably may be contributing. And as I said, you said nicely, because there's a tendency of your blood pressure and sugar to fall down. If you haven't eaten enough, your sugars may go further down. So this could be important. So it's why we talk about nutrition. We always talk about healthy nutrition. We don't want to be overdoing things which may cause problems. And in that perspective, probably hypoglycemia, or not really even hypoglycemia, maybe lower sugar levels, which are in the normal range, may also be contributing. Of course, anxiety of any forms, if you wake up at night, will be more exaggerated because then your stress response is not there. So if you're sleeping, body has left all their armors, everything is down, and suddenly you wake up, your anxiety will peak at that time. So I think there are other issues which we might have to look into in terms of the overall well-being, overall other factors which will be relevant in that regard.
One last question, doctor, and that is, I've come across some research which says that women need more sleep than men. Do you feel there's any truth to that, especially in the context of endocrine health?
See, overall, if you look at it, the burdens which are there in terms of the life are much more for women. So they, of course, have to do much in terms of the menstrual cycle, which requires a lot of energy. They are responsible for childbirth. They have lactation. So there's so many much. So the evolutionary burden which is being carried is much more. The weight is much more on the woman's shoulder. So of course, if you want somebody to do more work, you need to maybe have more benefits in terms of more sleep will be better in that perspective. Better nutrition becomes more important in that regard. So while we do see that there may be a greater requirement of these factors because you're doing much more as compared to the other individuals who don't have period, who don't have lactation, who don't have pregnancy, it is definitely an important factor. But these are all variations within the normal range. It's not that there will be a huge variation. So maybe if you talk about the curve, which is like this in men, maybe shift it slightly towards the right side, but most of them will have this overlapping perspectives. In our study, we didn't find any difference between girls and boys. So there's not much difference, but yes, these will be subtle things. So this would definitely mean that we need to take a special care, but that does not mean that there will be a huge hours of difference, maybe a few minutes, that sort of a thing we are talking about in that regard.
Any final things to share, doctor, on endocrine health and sleep before we conclude?
So I think the key aspect to remember is that endocrine disorders are one which do not have often overt manifestations, and they have long-term tolls which are there. So these are in a way responsible for our continuation of body functions, a lot of factors which are going on in our long-term fashion. And if sleep is one of the major determinants of the hormones, and if sleep is defected, you will not only have effect on the classical endocrine factors like hypothyroidism, diabetes, they will be effect on every part of your body. So hormones are regulating the way your brain works, the way your heart works, the way your digestion works, the way you are able to have normal activity, your skin, your hair, everything. So it's not just about the diseases, it's just about the overall well-being, where a balanced hormone system is important. And I would say one of the fundamental aspects, I would say three would be the ones, and one of the major fundamental aspects is a good sleep. The other, of course, is a good nutrition, and the third will be a physical activity. So within this triangle, I would say sleep is something which is often ignored in that regards. And if we want to be healthy, our hormones have to be healthy, and for that we have to sleep healthy in that regards.
And we have all our guests complete our show mantra, doctor. So if sleep is the new medicine, then how would you complete that sentence for us?
Sleep is the new medicine, and it's the new vaccine also, which can save you from a lot of these complications. So it's not just a treatment, it's actually a prevention as well. So it is going to save a lot of diseases. That's very important from that regards.
Thank you, doctor. And if people want to look at some of the work you've done, where can people go to have a look at that?
Yeah. So we have got multiple areas in which they can look at. We have a YouTube channel which has a lot of informative videos for not only medical professionals, but also for general public with regards to hormone disorders. There is the website growsociety.in, which has got a lot of resources with regards to especially things like growth, diabetes, obesity, pubertal disorders. And then there's my website, dranauragbajpai.com, where also information is available in these factors.
Thank you, Dr. Bajpai, for a great conversation. It was as I expected. Everything was so clear, and I think you really explained the importance of sleep in the endocrine aspect. And maybe at some point we could have another conversation specifically on hypothyroidism, because that's an alarmingly, it's growing so quickly, and everybody who I come across says they're on medication. So it would be great if we could go into that. But thank you for your time, and we were very honored to have you here today on the show.
It was a wonderful interaction to discuss upon such an important aspects and very, very relevant issues which you had raised. And I hope that you were able to address many of them, and it will be a pleasure to be part of future endeavors as well. Thank you.
Hey everyone, I hope you enjoyed the show. Just a reminder that this podcast is for information purposes only. This is not a substitute for professional care by a doctor or otherwise qualified health professional. This information is provided on the understanding that it does not constitute medical or other professional advice or services. If you are looking for personal help on your health journey, do seek out a medical practitioner. Please do make your own healthcare decisions based upon your research and in partnership with your doctor or otherwise qualified healthcare professional. It is in no way intended as medical advice, as a substitute for medical counseling, or as treatment or cure for any particular health condition. Be sure to always work directly with a qualified health practitioner before making any changes to your diet or lifestyle that may feel out of your realm of comfort or understanding. If you are looking for an allied functional medicine practitioner, do seek out more information on www.phytothrive.com.